ER nurses of Reddit, how often do all of those "one more minute and I'd be dead" stories get exaggerated? So, one story that I'll never forget is a family of 6, 2 parents, 2 kids, 2 grandparents staying over, who saved themselves from a collective carbon monoxide poisoning by sheer luck. Everybody was asleep, the mom got up to pee, and fainted from the carbon monoxide poisoning on her way back to bed. The sound of her fall woke up her husband, who checked on her and called an ambulance. The first responders' CO detectors went off upon arrival, and they evacuated everyone. If she didn't have to pee, they'd all be dead. If she just made a few more steps and reached her bed without fainting, they'd all be dead. If the husband had a heavier sleep and didn't hear her fall, they'd all be dead. If they thought the fainting was nothing and she'd see a doctor the next day, they'd all be dead. Instead, I had them all in the ER casually recovering from a moderate poisoning, chatting casually about this unusual night they were having, completely oblivious to how close they all got to make the local news the next day. It was eerie. Next story. We got our home most likely on a distressed sale due to CO poisoning. An elderly man in his 70s was the former owner. He lived alone, and he'd bought the place before CO detectors were mandatory. The central heating, water heating, stove, and oven were all gas-powered, and it's a seismically active area. All we knew when we first saw the listing and met the agent was the owner's son was handling the sale. The owner had collapsed, had been found by neighbors, and was no longer able to live alone. As we went through this place with the inspector, we noticed the fan above the stove didn't work. Minor issue, we can replace that ourselves. Then the vent to the water heater had come uncoupled. That was a trivial fix though, we snapped it back in place without tools in a minute. Then, going through the bathrooms, which were right next to the water heater, we noticed soot stains on both ceilings, just on the other side from the water heater, looking as if exhaust had oozed into the rooms. It was like piecing together a mystery. We bought the place and told the son what we had found. They hadn't determined the cause of his father's collapse, but maybe that information would help in treatment. Next story. I am doctor here. I had a guy who came in after feeling weird in the chest all day. 40s, athletic, in the middle of a divorce, stressed. EKG looked okay. I see nonspecific chest pain all day long, and it's usually heartburn or stress or asthma or a strained rib muscle, and I was so close to sending him out with some Malox. But there was something about this guy that made me send him to the ED. I asked if he wanted a wheelchair escort, and he said no, he'd walk. It was about 200 feet. Anyway, an hour later, I logged back into his chart to see how things were going in the ED, and the first thing I see is a code note. He'd made it to the ED, gotten some blood drawn, and turned out to be having a mild heart attack, and while the doctor was delivering the news and explaining next steps, he'd had a cardiac arrest. They got him back immediately, since having your arrest in an ED in front of an emergency physician is kind of a best-case scenario. When I saw him again a week later, he was doing great, but he told me that he had almost gone to get some food. It was lunchtime, before going to the ED, but decided against it. If he'd waited, he would have had his arrest in a Jimmy John's, and things probably would have not gone so well for him. Anyway, almost 20 years of practice, and that was my closest call. Next story. I recently had a patient carried in by her dad that was peri-arrest from anaphylaxis. Dad was uncomfortable using her EpiPen and thought he was close enough to the hospital to drive in instead of calling 911. She had weak central pulses, no peripheral pulses, and her BP was 50/30s on arrival. She was maybe minutes away from a bad outcome potentially. We did a lot of education and she ended up okay. If you have an EpiPen, know how to use it. Edit. The dad was well-intentioned, appropriately worried when he arrived, and cared for her lovingly at her bedside as she recovered. This wasn't meant to shame him. Emergencies look different for everyone, and allergies evolve quickly. She probably wasn't that bad when he decided to get in the car, and it's not always easy to know how bad something will get. But he got her to us just in time, which was what OP was asking about. To answer the prompt, there are very few of those cases, which is why this one came to mind. She was safe, and Dad learned a lot, so everyone won. Next story. Emergency call talker here. Most recent was a small child choking on some food. The ambulance my colleague sent was 10 minutes away, the helicopter 15. While I was giving first aid instructions to the parents, my colleague called the local family doctor, who in a stroke of luck took a last glance at his phone before he would have gone for a run where he would have left it at home. He was there within a minute and managed to dislodge the stuck food. Next story. ER doctor here. It is exceedingly uncommon to see a patient who would have died had they not come to the ER a minute earlier. I have had numerous patients make claims like this, and in the rare case that it's both potentially relevant to their current care and I have enough time to look, I've looked up the relevant records. In precisely 0 of those cases would the person have died if they waited another hour. Another day? Sure. I've had one personal case where the guy would have died if he had waited any longer to come in. He felt odd, lightheaded, nothing specific. 40-something, generally very healthy guy. Went into VFib right after he arrived. Shocked him out of it. He went back into a fatal arrhythmia a few more times but ultimately stabilized after more shocks and amio. If he hadn't arrived in the ER when he did, there's a high chance he either would have died or not walked out neurologically intact like he did. So I have to say that OP addressed something that I noticed probably after the second or third story, which is we're not really getting stories relating exactly to the question, which is 1 more minute and I'd be dead. So it seems like we're going to get less down to the minute and just more general close calls because like OP said right there in that comment, it doesn't really happen. But anyway, next story. I'm a respiratory therapist and I work in the ER. It's pretty common to have patients code in the ambulance on their way to the ER, but I think these situations, they know right away that things are bad and that they barely make it. One of the paramedics who taught my CPR class said that since we're in a dense but geographically small municipality with 2 hospitals, the chance of surviving cardiac arrest is much higher than average. They call once they're in the rig and they're outside the hospital by the time the report is given. Next story. When I took an EMT class a couple of decades ago, they said people die when they expect they will die. People survive when they expect to survive. They gave us examples of bullet wounds soldiers receive are more survivable than civilians, as civilians assume if they got shot they will die. But another example was when a surgery had a low percentage survivability. Having someone say almost everyone they've seen get this surgery survive statistically increased patient survival rate. Likewise, telling people their odds of surviving being low decreased survivability. In acute circumstances, for lifestyle changes though, telling people if you don't lose weight or quit cigarettes you'll die soon makes people live longer. The takeaway was just telling someone you're an expert and that they will be alright increased their survivability. Telling them they were going to die decreased it. Next story. My stepdad showed up at the hospital for a scheduled colonoscopy with a heart rate of 23. He was admitted immediately and given a pacemaker. Not really a 1-minute situation, but if he hadn't had the colonoscopy appointment, he would have stayed home alone all day and probably had been dead by the time my mother got home from work. Next story. L&D nurse here. I had a patient who was 38 plus 3, pregnant with twins. She was checking in for a routine induction, history of panic disorder and anxiety, but nothing else. Got her admitted over the next hour. She had some borderline hypertensive pressures, high 130s over 80s, and when I placed her IV, her heart rate went up to 130. Concerning, but in no way emergent, and possibly related to the panic disorder. With no obvious event or explanation, baby A had a precipitous drop into the 50s. I went into the room and her SATs were in the 70s, heart rate 178. We ran her to the operating room and delivered her emergently, then transferred her to the ICU. Final diagnosis? Acute heart failure with an EF of 17%. It was sheer dumb luck that she was scheduled for an induction within an hour of her heart deciding to crump. Next story. I was patient transport services in high school. My favorite was a guy who had gotten in a car accident and had his bone sticking out of his arm. He did the "I'd have been dead in a few more minutes" and kept trying to have all services directed at himself. 1 hour later, they brought in his passenger who had his arm torn off and was impaled through the chest with a piece of a sign after they freed him from the wreck. He demanded starbursts and water ice at our earliest convenience. Next story. A couple of years ago, I had a 13-year-old boy come in one time after a skateboarding accident who had a sizable epidural hematoma, but was neurologically fine. Hospital I was at did not have a pediatric ICU, and I am not a pediatric neurosurgeon, so was arranging for helicopter transfer. As that was brewing, he went comatose and blew a pupil, so I took him to the OR for a cranie and evac, then straight to CT to confirm no recollection, then helicopter to hospital with PEDS ICU. Just the nature of epidural hematomas. If he had blown a pupil in the helicopter, not insignificant chance he would have permanently been injured or have been dead on arrival. Next story. ER nurse here. I'm of the opinion that I would rather you come in and have us say, "It's nothing, go home," than not come in when you really should have. That being said, most of what walks through the front door could be treated at an urgent care during normal business hours. It's cheaper, I guarantee it. I've had 2 patients in my care that experienced those. One guy had a little upset stomach and generally feeling crummy. Nice guy, really chatty. We put him through the CT, and I watched his abdominal aorta dissect as the images came up. The serendipitous part was that the trauma team just got finished with one guy, so they were all 2 rooms down. Guy brought in baked goods for the ER staff. Next story. I never really saw this in the ED, to be honest, but the human body is amazingly resilient, especially when it has some time to adjust. I had plenty of people walk in, and I was like, holy crap, how long have you been walking around like this? In my last job, I had a patient who had a VT arrest while visiting his mom on the telly floor of our hospital. It could have easily killed him if it had happened almost anywhere else. He came through it neurologically intact and in pretty good shape, other than needing a heart transplant. Next story. My lung collapsed and I thought it was anxiety when I finally ended up in the ER, and I had to sign a paper, and then I went into a room for an emergency chest tube. The urgency in which they worked around me felt like one of those I could have died moments, but no one ever said it to me. I'm curious if it has ever actually been said to a patient out loud. Next story. When I was 12, I spent a week throwing up strange colors and having cramps in my guts. At the end of the week, I woke up one morning and it hurt so much I couldn't even get out of bed. My mom was very alarmed, called her friend who said I was probably faking and to see if I was better by Monday. This was Saturday morning. My mom fortunately decided to call an ambulance anyway, and I was rushed into an emergency surgery as soon as I got to the hospital. That week of lead up was my appendix telling me it was in distress, and Saturday morning, it burst. According to what I was told later, another hour delay and I'd have been dead from the toxic crap that my guts were swimming in. As it was, I spent almost 2 weeks in the hospital. Next story. So, a minute? No. However, you realistically have about 5 minutes in cardiac arrest as an adult, with no intervention, before you'd be significantly brain dead. Anything where you're not breathing, i.e. choking, cardiac arrest. Opioid ODs, though, the minutes absolutely matter, but probably not anything outside of that is so time-specific. Next story. Not quite a minute or two, but hours myself. I was so far into diabetic ketoacidosis before I was first diagnosed with type 1. I was so weak I couldn't even make it back down the stairs to get to the ER after a doctor visit. I was in DKA for months before my body started to fail. My mother had left the state for the weekend, so I was alone and couldn't do anything. Thankfully, she came back when she did because even the doctors and nurses said I wouldn't have made it another day. Spent almost a week in the ICU before I was even stepped down to the ER. Next story. Not quite the same, but many years ago, I had accidentally overdosed on fentanyl. Haven't touched anything in 9 years, but yeah. By the time they got me awake, they used 2 bottles of Narcan. My lips were blue, and my breathing was so labored that they told me if they were a minute or 2 longer, I'd be dead. Well, folks, first off, good thing that OP survived, because, if they were dead, they wouldn't be able to tell their story. But this one understood the assignment. This was you would be dead in a minute criteria. This answers the question, so good job. Let's give a round of applause for OP for the dramatic timing. Good job, OP. Thank you. That's a joke, everybody. Anyway, next story. So, blue lips and short of breath but refused to go. Ambulance came, the ER nurses tried to explain and helped calm my husband before I was put into an induced coma. I had heart and lung failure due to sepsis. Chest tubes were placed and surgeries followed, but sincerely, it was the ER nurses and ICU nurses that saved me multiple times from drowning in my fluids and lack of O2. They believed me. It wasn't anxiety. Thank you, nurses. They held my hand and stayed with me when I was scared. Next story. My mom was told that if she was 30 minutes later bringing me into the ER, I would have died. To be fair, I was 5 months old and had a severe case of rotavirus, and I was so dehydrated that my eye sockets were sunken. They also had a lot of trouble getting an IV in me because my veins were collapsed, so they had to put in a port. Next story. I exaggerated one once on purpose, and it saved my father's life. He woke up one morning feeling weird. No pain, no dizziness, just a consistent feeling of strangeness in his chest and stomach. He said it almost felt like indigestion. After drinking some water and the feeling not going away, he asked me to drive him to an urgent care facility. About halfway there, he says to me that he was starting to feel dizzy and he was getting tunnel vision. I knew he had a history of heart disease, so I made the decision to go to the ER instead. As I walk into the ER, the nurse at the desk tells me to take a seat and she'll call me when she's ready. There was already someone checking in at the desk and a line of people behind them. I knew that explaining the situation would take too long, so I pushed the person out of the way and told the nurse that my dad couldn't breathe. And that got him rushed past the line and into an open room, where he was found to be having a heart attack. 2 IVs, a crash cart, and a defib later, he was stable. He was moved to another facility where he had open heart surgery and has since made a full recovery. The doctor told me that it was already a razor-thin margin that he made it, and had I taken the time to wait in line or try to make that nurse understand the whole story, he wouldn't have survived. Next story. I'm not an ER nurse, but I will share my own story. My son was in the NICU after giving birth to him at 32 weeks, complete placenta previa, and I was visiting him for the weekend. But I got the worst headache of my entire life, and nothing was helping. Next thing you know, I began to feel really weird and couldn't breathe and called the nurse in. I was having a stroke. If I had not been there and the nurse hadn't come in that very minute, I would have been a lot worse off. They were able to get me on oxygen immediately, and it was below 80%. Next story. ER nurse here of 2 decades. To be honest, a lot. That being said, we often tell people these things to underscore the importance of them coming in. You have no idea how many people take 2 Tylenol for their chest pain and take a nap versus coming to the ER, or think the worst headache of their life will go away. I've had a few patients where it was literally, if they hadn't been in front of us, they would have died. A few. But in the end, I want people to know if crap seems weird, just come in. Next story. I have a story that happened to me. When I had a hysterectomy, I was sent home to heal. There was a lot of endometriosis, so the cut was huge and the doctor used staples to sew me back. Well, I had an allergic reaction to the staples. My stomach was swelling up. I went back to the ER, but I had been swelling up, so I had started to break open from where they had closed the wounds. At the ER, I was checking in, and things went sideways fast. I started bleeding out in the ER waiting room. I woke up in the after-surgery area and had to have a blood transfusion, several pints. I have several autoimmune diseases, so it's not crazy for me to have weird reactions to things. My doctor told me I am the only person he ever had who was allergic to surgical staples. So this is the first time I've ever heard of somebody being allergic to surgical staples, so that's a new one for me, but I guess it's bound to happen, as rare as it is. It's like in Halo Forward Unto Dawn when Captain Lasky was allergic to cryosleep. Anyone remember that? Any Halo fans? It's hard being a Halo fan. Anyway, next story. ER nurse here. All the time. I hear them in the ER because it's often the first thing people mention, and they'll go on to use terms they heard from the doctor that they don't understand, but shows that they were fine. Then I'll look in their records and I'll find it to be BS. But it happens, for sure. Maybe not 1 more minute, but 1 or 2 more days. I'll see that a few times a week, which yeah, it's an emergency department. That's what we do. Next story. Not an ER nurse, just a witness. Rush hour morning traffic into the sun. Guy ahead of me on a motorcycle. Truck in front of motorcycle guy. Truck had a huge wooden box of some sort vaguely strapped down into the truck bed. Motorcycle sees an opening, past truck, and he's out of there. Seconds later, box falls out of truck bed, splintering into a million pieces, causing a lot of chaos for those of us behind it. Motorcycle guy dodged death by seconds, and we'll never know about it. I still think about you, motorcycle guy. Next story. I'm not an ER nurse, however, I am a recovering acute myeloid leukemia patient. I was told that my prognosis wasn't ideal by very skilled and cagey communicators. I picked up on my care team's careful wording very early on. They never made declarations like, you only have a certain time frame. Making promises and definite declarations opens them up to lawsuits, so they need to be very careful about what they say. The only time anyone came close to saying 1 more minute and you will be dead is when I was preparing to have a bone marrow transplant. Unfortunately, the pre-BMT testing showed that my leukemia had come raging back. I remember the initial phone call I had with one of my oncologists after the new wave of cancer was discovered. He repeatedly apologized, told me that sometimes he just needs to sit in his car and scream in frustration while we discussed the next steps, and bless him, I can't imagine the stress he works under. I would scream in my car too. But reading between the lines, I definitely understood that no oncologist apologizes like that unless they feel like they have failed. Years later, he disclosed that he was shocked I made it to remission. Maybe I didn't, and I still don't ask the right questions in the right manner to elicit a dramatic response, but this has just been my experience while living with a severe illness. Next story. So to answer your question, not that often. But recently, we had a patient who was coming by EMS as a STEMI, then coded in the ambulance bay. Got him in the cath lab immediately, and he survived fully neuro intact and went back to work a month later. If he had driven himself to the hospital, or if EMS had chosen a hospital slightly farther away, he probably would not have had the same outcome. So for those who don't know what a STEMI is, like myself, because these people use terms normal people have never heard of, it means segment elevation myocardial infarction, so heart problems. And for those who don't know what a cath lab is, it's a hospital area with special imaging equipment used by medical teams to diagnose and treat heart conditions through minimally invasive procedures. So now you know if you didn't already. Next story. So, I'm certainly no ER nurse and was obviously too young to remember it or be able to validate, but I'm told that a few weeks or months, not sure, after I was born, that 1, I was sleeping way too much, 2, my mother had already had 2 kids, so she knew it was particularly unusual. 3, she took me to the family doctor who immediately called an ambulance, and there was a team waiting when I got to the ER. 4, I had septicemia, and it was pretty much touch and go. Story goes that my parents were warned that they may need to start making arrangements. According to the story, if my mom hadn't already had the experience of having a couple of bubs, then she probably wouldn't have clocked that I was way too sleepy for a newborn. I was told this story a few times growing up, but now that mom is older, she says she doesn't even remember it, as with most of our early years. No idea if it's true or not, to be honest. The other near misses in emergency I remember were the almost monthly childhood asthma attacks that always had dad racing through red lights and occasionally being stopped by cops who then escorted us to the ER, after which I'd spend a week in the oxygen tent. I definitely remember those, but can't attest as to whether I was really minutes away from death or not. But yeah, can't really validate the first story, but I always feel for my parents and how stressful it must have been for them with the almost monthly visits to the ER for asthma. I'd be terrified if I had to go through that as a parent. Next story. This is before Uber and 24-hour urgent care centers. Got called out for an unknown medical around 3 in the morning. Arrive on scene to find a lady in her 40s dressed, sitting in the lobby of a condominium building. She was staying at a friend's apartment for the week and didn't have a car. She was embarrassed that she called 911, but she was having such terrible indigestion since 11 p.m. and was afraid she had food poisoning. No problem, so we load her up, get a set of vitals, and then she mentions that it doesn't get any better or worse when she lays down or sits up. That is a red flag in EMS. 99% of the time, it's cardiac related. We hook her up to the EKG and she's throwing tombstones. My partner and I look at the monitor, look at each other, and both go, crap. We started 2 IVs, aspirin, morphine, and booked it to the nearest hospital with a cath lab. When we came into the ED, the cardiologist is already there. He takes a look at the monitor, now running a full 12 lead, asks a few questions. We take her directly to the cath lab, and she codes. We got her back after 1 shock, stabilized her, and they performed the catheterization, and I heard she did fine in the cath and made a full recovery. Next story. My one friend is an ER doctor and the other is a surgeon, and they were both watching TV while I'm playing on the computer, and their answer is, the ER doctor said, "It happens, it's not the most common thing, but the reason you hear so many stories about it is because people who really will die without immediate intervention wait until the last second to come in for help." Then the surgeon said, "Second, I can't tell you how many people will know something is majorly wrong and wait until they're on death's doorstep to get it looked at." The conversation then proceeded about a lady who was crapping out of her vagina for 3 months and somehow survived, and it was only known when she came into the ER for her foot rotting off due to diabetes. They used a lot of big words I don't know, but that's the gist of the story. Gross. Next story. I don't know if mine really counts, but when my son was 11 months old, he started having respiratory issues. We called the on-call pediatrician, and he tried to explain the whole sucking on the abdomen, and if it got to that, then to bring him in. This was like at 9 p.m. on a Saturday night. I stayed up all night with him when he coughed and didn't sleep and didn't drink any milk. At 8 a.m. the next morning, I took him to my nearest urgent care. They sent me to a different urgent care. I went to that, and the PA gave him a breathing treatment. At this point, his oxygen level was at 82%. I knew absolutely nothing about what this meant at the time. The PA said it was up to us if we wanted to take him to the hospital or not. He was completely casual about the whole situation and didn't express any sort of concern, so we didn't think to be concerned either. We decided that we would take him to the hospital just to be safe, and opted to call an ambulance because the nearest hospital was 30 minutes away. Thank God we did. When the EMTs arrived, they were shocked at the lack of concern and immediately insisted that we rush to the nearest children's hospital with lights and sirens. As we were driving, my son started to lose consciousness. It's been 4 years, and even as I'm typing this story, I have chills. I don't know what would have happened if any different decisions were made that day, and I will never forgive myself for not taking it seriously sooner. We visited the hospital several more times with him, and he was diagnosed with asthma. I will say, we all learned to take it seriously, and the following hospital visits caught it very early. Next story. Oh, my favorite. So, I had a patient a few years back. Went in for a routine OB appointment. Her office was connected to the hospital. This is important. She was getting over some respiratory bug that her daughter gave her, but was doing okay elsewhere. She sat down in the chair for vitals and promptly passed out. BP low as hell. They called a code blue, whisked her to labor and delivery, it was a very quick walk, and ended up doing a crash cesarean, and her belly was just full of blood. Trauma surgery had to get called in to assist, and they found she had ruptured her spleen right then and there in her OB office. Anywhere else, her and that baby would have been dead. They both had great outcomes, though. Next story. Not a nurse, I am a lifeguard. I was on vacation, and it's habit to scan the water and count kids. I had a group of small children I counted, and there was 7 of them. I kept looking around, just kinda hanging out on the beach. Next time I looked, there was only 6 of them. I was pretty sure none had left the water. They were on a sandbar type thing and would have to walk directly at me to leave by walking. I got nervous and got up to look. Started walking out on the sand, and I could see neon green underneath the water. I swam over as fast as I could, it was off the sandbar, and pulled out a 7 or 8-year-old boy out of the water, ran him to the beach, and slammed his back. I could feel a pulse, but he wasn't breathing. I gave one rescue breath, and that kicked his system back on, and he choked out water and started to breathe. If I hadn't been watching, or if I didn't get up to make sure one hadn't gone under, he would have definitely died. The parents were facing away from the water, so they could only face the sun. Just assumed since the sandbar was there, it would be okay. Only 2 out of the kids could actually swim, by the way. Next story. PT here. I was a new grad at the time, like 2 weeks off boards fresh, working at a rural hospital. I had an eval in the last spot of my day on a Friday for back pain. Woman walks in, and I can tell she's in way more pain and discomfort than what she's put on the intake form. We are going through the eval, dots for straight musculoskeletal pain were not connecting. Absolutely nothing I did reproduced her pain. And as I'm helping her to roll to her side, I feel her heartbeat in her abdomen, and my mind is screaming. A AAA, abdominal aortic aneurysm. So I politely escort her to the ED below the clinic. Mind you, everyone in the clinic has gone home. It's just me and my newbie skills. And the triage nurse heard me out, bless her soul, and had the woman immediately taken back. The woman I evaluated ended up living. I was right. She did have a AAA. That if I had just sent her home, the surgeon told her she would have died because it was very close to bursting. She writes to me on every memorial of the day I met her. She says I was the only medical professional that finally took her pain seriously, and that I am her guardian angel. All I can say is thank goodness for differential diagnosis and clinical reasoning skills, and maybe, just maybe, a really scared new grad PT. 6 years later, still a very proud moment of mine, but just doing my job. Next story. My dad had a food truck chicken sandwich years ago in the 80s. He was a long-haul truck driver coming home from Quebec to the Maritimes of Canada. And he started to get crampy, pulled his fully loaded tractor trailer, a lumber flatbed, off to the shoulder of the Trans-Canada Highway and got out to urinate in front of the grill. Said blood was pouring out in his urine. He did manage to get back in the truck and got it going again, and not very much longer, he got severe pain in his lower belly. So bad, he couldn't push in the clutch in all the way. He used the CB radio to try to get someone, but being Quebec, everyone was speaking French, and he did not parlez. He finally got one guy to answer, though, and Dad told him that he wasn't sure what was wrong, but he doesn't know where the hospital was or if he could get to it with the big rig. The guy told him to make it to exit whatever it was, and he'd meet up with him and an ambulance. Guy was a truck driver running alongside Dad by this point, having caught up to him. He'd radioed dispatch, who called emergency services. By this point, Dad was getting weaker and weaker and wasn't able to get the truck to come to a halt. The other truck driver moved his box trailer in front of Dad, who'd managed to gear down, having never truly gotten up to speed, and Dad deliberately ran into the back of the other driver, coming to a halt. The ambulance arrived, and off he went to Camp Belton, NB, and into surgery for a perforated bowel and blood loss from a chicken bone in the sandwich. The surgeon told my mom that Dad was about 30 minutes from bleeding out, had he not made it to the care. Next story. I'm a psychiatrist, so we don't have a ton of these type of stories, but there is one that sticks out in my mind from residency. I was on call one night when I got a call from an outpatient of one of the attendings in the clinic. The PT's wife said that he had recently started a new medication and wasn't feeling well, and just wanted to make sure it was nothing serious, apologizing for bothering me. I looked in the PT's chart and noticed that he had a history of liver issues and was currently being monitored and treated for cirrhosis. The medication he had recently started was known to be hepatotoxic or potentially damaging to the liver. The PT's doc should not have started the medication given the PT's history. I discussed the situation with his wife, who reported that her husband had been feeling ill, vomiting, felt weak, had abdominal pain, and when I asked, reported that his skin and whites of his eyes were yellow. She also noted that he had been displaying progressive confusion and seeming out of it. I told her not to give the PT new medication anymore and to either bring the PT to the nearest emergency room or call 911. She asked me if that was really necessary, as she and her husband were already in their pajamas and were going to bed soon. She asked if they could just go to urgent care in the morning, and I basically said, "Ma'am, if that were my father, I would either be on the phone with 911 right now or getting in the car to come over and bring him to the emergency room myself." And she seemed to take that seriously and said they would get dressed and go in. I checked in about 1 to 2 hours later on the PT's chart and saw that the wife did bring her husband in, thankfully, and that he was immediately admitted to the ICU with acute liver failure. His exam findings and labs were pretty terrible. Had he and his wife gone to bed with the plan of going to urgent care in the morning, he likely would have died. Otherwise, I have definitely had my fair share of PT stories about being on the brink of death when they weren't, having experiences within healthcare that would never happen or are impossible, or presenting labs/exam findings, med doses that are meant to show the severity of something that do the opposite. Most of the stories I've read on Reddit about people reporting that they woke up during surgery seem incredibly exaggerated, if not completely made up based on the way that ORs are set up and how surgeries are done. So just about any story you see, including things like, "So the nurse saw my leg and just started screaming," or "all the doctors and nurses were shocked and had no idea what to do," are likely exaggerations as well. There is very little that actually shocks medical staff, and nurses have seen crap and can handle a lot. I've had numerous patients sit down in front of me and say that they are likely the worst, most effed up person I'll ever meet, that they've gone through the worst trauma I've probably ever heard of, or made comments like, "Yeah, you're probably wondering how I'm even still alive right now." In all cases, they have been wrong. The worst, most effed up patients I've ever met don't consider themselves so. The worst trauma I've ever heard of has come from patients who don't put a lot of thought into comparisons. There are definitely PTs that amaze me by still being alive, but none of them boast about how bad they have it, like there's an award for the most suffering a human being can experience. Next story. Not an ER doc, but the story of my birth kinda touches on this. Without too much detail, around 9 a.m. December 2nd, my mom went in for a pregnancy checkup and was told she needed to be admitted right away and induced, or she and I will die within the hour. "Ma'am, you will have a stroke and die at any moment." And she didn't listen because she had 2 other kids and a husband who couldn't leave work. She went home and basically laid on the couch trying to stay calm and not raise her blood pressure anymore. It was triple over triple at the doc's. She went to the ER the next morning while her OB was waiting. She was injected with the medication to get things started, and I came out in 3 light pushes. The doc had to catch me with one hand as a result. Sans a few days in the NICU because I was a preemie and my mom needing a little observation, we were fine. She's an unreliable storyteller, but she tells it like she was on the verge of death and was actively fighting the Reaper himself. Obviously, she was in trouble, but not like that. Next story. I'm in the UK, and I will say to patients, "I'm glad you came in or you left this to the last minute," but I don't mean to the literal last minute on the whole. If it's that touch or go, people usually do lose their pulse. Plenty of people go into cardiac arrest on the ambulance or while being wheeled in. I've never had someone come in peri-arrest and then got them immediate treatment where I'm like, phew, that saved them from the brink. But some people who have had fantastic responses, known aneurysm payment collapses and ambulance on scene within 3 minutes. They tell A&E they're coming in, and we let the vascular team know, and they start letting theater staff know. Patient spends 7 minutes in our department getting blood tests, including transfusion match samples, cannula, consent for surgery, and handshake from surgeons before being whipped upstairs and surviving. In stuff like this, every minute counts. But I'm never like 1 minute later would have been the last minute. But I guess I don't think you had another 15 minutes to spare has the same ring to it. Next story. I'd rather have patients who exaggerate and turn out to be stable than risk the one who dies. Patient came in GCS 15, blunt force trauma to the head. GCS went from 15 to over 8 in about 15 minutes. Had they arrived a minute later, they could have potentially suffered more lethal consequences. It was horrible when the patient was talking and responsive and then just stopped. Each case is different and depends on highly individualized circumstances, so it's impossible to definitely say if there's an exaggeration or not. Or patient was in MVC, complained of chest pain, heavy nosebleed and staining down their front. Patient did not mention bullet lodged in upper thigh from incident before MVC. When moving patient to trauma bay from EMTs, blood everywhere. See, this is what I mean having read so many of these videos. These people with in the medical fields never tell us what these things mean. You'll also see this with military people. If you ever listen to these type of videos and you hear military terms, they never explain what they are. But anyway, GCS stands for Glasgow Coma Scale, a standardized objective tool used to assess and monitor a patient's level of consciousness and the severity of brain trauma. And then they also mentioned MVC. It means mean corpuscular volume, a blood test measuring the average size of blood cells in motor vehicle collision. So now you know. Anyway, next story. So, my gallbladder went septic. I had been getting gallstone attacks the previous 2 years. They were so painful that I started to keep a log of each incident. I had no idea what was causing it. It felt like I was dying for about 45 minutes, and then the pain would vanish as quickly as it came. After having a fever of over 101 for a few days, I finally went to the doctor, and he did an ultrasound. I was about 6 hours away from home when I got the call saying that my gallbladder had gone septic and it needed to come out immediately. I drove back 4 hours to another town and checked into a hospital where we knew one of the surgeons, which happened to be the one who took the gallbladder out. He said he was very close to opening me up completely to get all of the infection out. A 30-minute surgery turned into a 2.5-hour surgery because he chose to do it laparoscopically. I still don't realize how close I was to sepsis. Next story. Animal ER nurse here. Had a client call in a Monday morning because she was bitten by her cat the night before and she wanted to know what to do. Further questioning revealed that on Friday night, the cat got into a fight with a skunk and had several wounds to its face. Found the skunk dead on Saturday. Sunday, the cat was acting weird and bit the owner. Cat died Monday morning. Told the owner she needed to bring the cat's body in for rabies testing ASAP. She responded that her husband had already buried the cat. I told her, please dig it up and bring it now and go to the right hospital. She refused because she didn't want her name in the paper. I told her her name would 100% be in the paper when she died from rabies, and she hung up on me. I called the number back, and her husband picked up. I explained the seriousness of the situation, and he agreed. He had the body to us in 20 minutes and took her right to the hospital. Next morning, we got the positive rabies results from the state lab. That lady would have died because she didn't want her name in the paper. Next story. Not an ER nurse, but my grandfather had an aortic aneurysm rupture in his sleep. Something woke my grandmother up and she still isn't sure what it is, but she looked over at my grandfather and found him all but dead. She called 911 and they got him to the hospital alive, only to be told they couldn't do the surgery to save his life. And worse, it was storming outside, so they couldn't life flight him. So he got transported 25 minutes to a hospital big enough to save him, where one of the best heart surgeons on the East Coast just so happened to be there temporarily, who they woke up and met the ambulance at the hospital. You know it's bad when the surgeon admits he doesn't understand how my grandfather made it to his operating room alive. Grandfather ended up in a coma for 10 days, remembering absolutely nothing. Last thing he remembered was going to bed, woke up 10 days later. Next story. Triaged a not-so-fit guy in his 60s who had pain in his anterior chest. reproducible on palpitation, after lifting weights on his Chuck Norris weight bench. We were swamped, so I checked his vitals, normal, and put him in a fast-track bed. Obviously, he pulled a pec, right? But he told me he had some cardiac history. So I tell the doctor I'm going to do an EKG just for craps and giggles. And oh crap, his heart rate is now 37 and he's looking a bit gray. Full workup, EKG normal except for bradycardia, cardiac enzymes okay. We were a small hospital, but our consulting cardiologist says he knows him and he'll admit him, but we can just do a CTA to rule out a PE. I went along to CT and watched on the screen as that image appeared, as his aorta suddenly became this massive bulge, because he was dissecting all the way from the arch down into the abdomen. I've never run a patient down from CT that fast in my life. It wasn't close, and prayed that hard for the helicopter to get there. He was on the table at the tertiary care facility in another 25 minutes, and they saved him before it burst. Next story. I'm not a medical professional, but one time my wife got very sick with the stomach flu, and she is type 1 diabetic. She ended up going into diabetic ketoacidosis, DKA, and I kept trying to get her to go to the hospital before she DKA, and eventually she calls me into our bedroom. She can't see or walk, so we rush her to the hospital, and they told us if we waited even an hour more, she would have died. This was 2 weeks before our wedding. She spent a whole week there in an ICU. Next story. Also not a nurse, but a spouse of someone who had a close call earlier this year. Husband had been complained of a sore throat for a week, and I'd been moaning about man flu. I'd taken him to his primary care practitioner twice, and he had checked him out and found nothing of concern. No visible inflammation, no temperature spike, lungs sounded clear. On the Friday night, he woke up in the middle of the night with a stabbing pain in his throat. It took to nearly lunchtime Saturday to convince him that the next stop was the emergency room, as per the GP's instructions if things didn't improve, as they had access to imaging that we didn't have. We went down to the ER, waited maybe 5 hours for him to be seen. They did some standard checks and were about to discharge him when the attending heard him speaking with one of the nursing staff answering the discharge questions. The attending then told them to get my husband to x-ray immediately. The next thing we knew, he was being admitted to be transferred to another nearby hospital that had an ICU and an ENT ward. He had Epiglotus and the throat was about to fully close. If you've ever seen the TV show The Pit, where they have to do the cricothyrotomy, that's what would have been needed if things had progressed further. He wasn't allowed out of the line of sight of the medical staff until he was handed off to the transfer team, and he spent 3 days in the ICU while they got the swelling and infection to go down. We found out later that apparently Epiglotus presents with a specific sound when speaking. The attending had only ever heard it once before, and we are lucky he recognized it when he walked past. Everything went from 0 to 100 in a blink of an eye. Do not recommend. Next story. It always makes me roll my eyes when people say they nearly died of appendicitis because my appendix was minutes away from bursting, and if that had happened, I could have died. Well, my appendix did burst when I was 15, and yeah, it wasn't good. The surgery took a lot longer than expected, by the way, because they didn't realize it had burst and were surprised to find that necrosis had set in and my insides needed to be really thoroughly washed out. But at no point was I at any serious risk of death. I never had peritonitis or sepsis or anything like that. Well, folks, those are the stories. Feel free to go down in the comment section and share any medical scenarios that you think are worth talking or sharing about or relate to in the video, because I'm always in the comments section. But anyway, hopefully you enjoyed the video. Hopefully you enjoyed the medical terms being elaborated a few times throughout the video. But thanks for watching. Have a good one, and bye!